Good evening, everyone, and welcome to our weekly question and answer here on Facebook Live. I have the pleasure of being joined by Commissioner Larry Vignola and also our medical director, Dr. Peter Antevi. Before we get started, if you have any questions or comments, please remember to put those in the comment section of the video, and our city staff will be happy to answer those for you. With that, I'd like to turn it over to Commissioner Vignola to provide us with some updates.
Thanks, Alex. First, on behalf of my fellow commissioners in the city of Coral Springs, I'd like to extend our gratefulness for our teachers. Today, we celebrate the first day of Teacher Appreciation Week, and they deserve gratitude always, not just for a week. Our teachers have gone above and beyond to keep our children learning, especially during this crisis, and no words can truly describe how indebted we are to our educators. Thank you for your commitment and hard work always.
I'd personally like to also thank our teachers at this time. You guys are really the foundation of our society. By providing quality education to our youth, you're securing the future success of our country.
Yeah, and today we're also selling public service, and this year it's very special given the circumstances. I want to thank you, Alex, and all city staff for protecting our residents during this crisis. I know it's been challenging, but your efforts have made our city safer every day. And a big thank you to you, Dr. Antevi, all our doctors, nurses, and first responders on the front lines showing tremendous strength and compassion during this very difficult time. You are our nation's heroes.
Thank you, Commissioner, and I'd be remiss if I didn't also thank you for your service and commitment to the city of Coral Springs before we move on. I'd like to start by asking Dr. Antevi a couple of questions. Dr. Antevi, we've heard a lot in the news lately about different experimental drugs. We've heard a lot about different treatment options that are being used for COVID-19. I was wondering if you could provide our residents with a little bit more information about those treatment options and how they're being utilized.
Absolutely. Alex, great to be with you again. And Commissioner Vignola, thanks again for coming on. To the residents of Coral Springs, I would say that we are following all the data regarding the new treatment options. Let's start with hydroxychloroquine, which is, of course, a medication that's been used for many years with malaria, people with lupus, and so forth. And we come to find out that that medication has some severe side effects, which we know existed. And it turns out that the data is not suggesting that that medication be used, especially by the FDA at this point in time. And so moving on from that, the next thing is the plasma donation that we've made a big push for. That trial is still out there and is still going on with the Mayo Clinic specifically. We have had several of our own folks here locally donate plasma. There's another one donating today. So I really encourage people to continue to do that. That has shown some promise. And then there's remdesivir, which is essentially what they call the virus killer. It's a drug. It can only be given IV, and it really terminates the virus from replicating, and therefore the person can then heal and recover faster. There's some issues with that trial in that they only looked at whether or not it actually shortened the time of illness, and it did by about 4 days. But the problem is it didn't affect mortality, so it didn't allow more people to live than not live. And so the FDA has now given it an EUA, which is emergency use authorization. So there were some hospitals locally that were using it as part of the big study. Now other hospitals will be able to use that under the new FDA's guidelines. I've gotten a lot of phone calls this weekend from people all over the country saying, why isn't my relative getting remdesivir? So I will tell you that not every hospital will be using it. And so at the same time, I will tell you is that this is not the magic bullet that everyone's thinking it's going to be. Personally, and my colleagues also think that this medication needs to be given earlier. However, currently it's being given to people in the later stages of disease, people who are already intubated, people who are sick. And so there are those who feel like that medication should be given earlier in the course of illness. Really, ideally, Alex, it'd be nice if that medication was in pill form and it could be given early on in disease, but we're not there yet. And so there's a price issue, and then there's how do we give it issue, and now we're under the restrictions of the FDA and how we use it.
Thank you, and I think that's an excellent segue into my next question that I have here, which is can you please elaborate on where we're at in terms of a COVID-19 vaccine, and maybe any estimate on time frame of that, or also feasibility of a COVID-19 vaccine?
Yeah, that's a great question. I mean, we're all looking very carefully at where the vaccine is going to come from. There's a number of companies who are moving forward with a vaccine. Even one company that hasn't even finished the trial formally, and they're already ramping up production. Realistically, normally it takes 1.5 years to get a vaccine to market the right way. You've heard even Dr. Fauci say 12 months, which from January would make it January of 2021. I would say that that's something that may or may not happen, but more than likely it's not going to be in January. We're probably looking sometime in March or even later than that. And so you have to remember, vaccines, in order to be made safely, they have to go through a number of trials. Now they're finally in human trials. But then you have to scale up the production of those vaccines. So then the question is, who's going to get the vaccine first? So even if the vaccine is out, not everyone will have access to the vaccine. Of course, healthcare providers will get them first. So I would set my expectation to somewhere around maybe March of 2021 as when it starts to become available to the general public.
Thank you, Doctor. And finally, the last question I had here was, can you please elaborate on recovery rates? I know the Florida Department of Health has not been releasing recovery rates, but would you maybe speak to our residents a little bit about the mortality of this and just how many folks we're seeing recover from the virus? Yeah,
to answer that question, Alex, I think we have to split it up into age category, because we know that, for example, children do much better than if you're a teenager, and they do much better than if you're a middle-aged adult, and they do much better if you're older. And so I have some data here in front of me that I'll read, which is exactly what we're seeing here. But let's look at the Chinese data. The overall death rate for people who had corona was 1.4%. That's in total. But if you go to people in their 60s, it goes to 4%, and it goes to 8.6% death rate if you're in your 70s, and then 13.4% for those who are 80 and older. And so what I would say to everybody who's listening today is that if you have children, those children may be the vector for us to get it, or for our parents and grandparents to get it. There are also a lot of people out there who are lurking amongst us that look perfectly well and healthy, and they will end up giving it to others. And that's why I need to reemphasize here that although things are starting to quote unquote open up, no one should let their guard down. The experts think that there's going to be a massive second wave sometime in the fall. And so I think that we should practice, I know people use social distancing. I like to use the word physical distancing because we're still being social here. Wear your masks, you wash your hands with soap and water, use the Purell and other things. But at the end of the day, if you can avoid engaging physically with other people, I would do that, because this is not just going to go away. And just the final statistic people should know about is that the experts say that about between 5 and let's say 15% of the population has been exposed to coronavirus. That means you have 85 to 95% of the population left. And coronavirus is not simply going to leave our border because we want to reopen again. So it's going to come back. It's going to come back in a way that I think people don't really have a good grasp of yet. So please take precautions. And if you're a nursing home, assisted living facility, if you have elderly parents, I would really enforce that you be very, very careful, because you're at the highest risk here of a bad outcome.
Thank you, Doctor. That's all excellent information. I appreciate that. As many of you know, we did start to transition to a little bit of a recovery mode here as we start to reopen certain aspects of our city, our parks being one of them. And as we've reopened our parks, that does not mean that every business is open. It does not mean that every park is open. I'd also like to reiterate to folks that as we start to reopen around the state, as Dr. Antebi just mentioned, it's very, very important for us to practice that physical distancing. It's very important for us to make sure that we're continuing with our hygiene. hand washing, making sure that we're not touching our nose and face, and making sure that we're wearing masks and taking proper precautions when we're in the public. I'd also like to outline for all of you that we saw the governor mention we're starting to look at a difference between non-essential and essential businesses and transition into high-risk and low-risk type of interactions. Around the state, things are going to start to open, and as those things start to open, it's more and more important for us to focus on what's high risk versus what's low risk. So in the coming weeks, we hope to have more information for you in terms of what the reopening strategy will look like for South Florida and what the reopening strategy will look like here in the city of Coral Springs. We will continue to follow the guidance set by the state. We will continue to outline that and implement that here in the city. So I appreciate all the good information you just provided us with, Dr. Antevi, and I'd like to transition to Commissioner Vignola. Commissioner, can you please give our residents an overview of what's open here in the city of Coral Springs?
Yeah, Alex, it's important for everyone to understand that we'll be opening our city slow and steady. Our top to be the health and well-being of our residents. We've opened parks and some of our parks in the tennis center with limitations and some restrictions. As far as the parks go, community and neighborhood parks are open from 8 a.m. to dusk for limited activities such as walking, jogging, hiking, and cycling, nature walks on trails, and quiet enjoyment of the outdoors. We're allowing the use of our fields with safe social distancing in groups less than 6. Organized sports are not allowed. The tennis center is open Monday through Friday from 8 a.m. to 8 p.m. and from 8 a.m. to 3 p.m. on weekends. However, the tennis courts at Cypress Park will remain closed at this time. Visitors can play singles tennis and must make court reservations and payments by phone at 954-344-1840. The following are all still closed. The Senior Center at Satori Hall, the Aquatic Complex, the Fitness Center, all of our playgrounds and outdoor exercise equipment, the dog park, recreation buildings, picnic shelters, the gymnasium, and skate park. The Mullins Park and Cypress Park pools are also closed. Restrooms are closed within our parks.
Thank you, Commissioner. Thank you, Commissioner. I appreciate that update. I'd also like to provide our residents with a little bit of information. It's consistently been the top priority of our city commission and our city management to focus on the needs of our businesses, particularly our local economy. The city did form an economic recovery task force. That recovery task force met this last week to discuss strategies needed to help our local businesses and our local economy throughout this tough process and also throughout the reopening task force. The reopening task force is made up of membership, including our local businesses, our city officials, and also our mayor. This task force is going to continue to work on strategies to help our local businesses and our local economy. Second, I'd like to remind everyone that we have a food distribution that occurs every Tuesday morning at 9 a.m. That food distribution provides food to approximately 700 families, and it's located on the north side of our mall. If you're in need of meals, or if you know folks who are in need of meals, please encourage them to stop by that food distribution so that we can help you. Another priority that I want to bring up, and something that we may not want to think about right now, is hurricane season. Hurricane season is just around the corner, and as we deal with COVID-19, our preparedness is going to be more difficult than ever. I encourage you all to take the same preparedness efforts that you would if this were any other year. Focus on providing enough food and supplies for your family. We encourage you to have at least 72 hours at a minimum, but I'd encourage you to keep at least 5 to 7 days worth on hand. We've been working with staff here in the city to make sure that we're amply prepared to deal with not only coronavirus, but also with hurricane season. God forbid we were impacted. Just as we serve the city during any emergency, we're going to continue to work to be prepared to serve the city in the event of a hurricane this year. Before we conclude this Facebook Live, I'd like to provide our residents with a couple of best ways that they can stay connected with our city. You could call our city's call center at 954-344-1001, or you could also text the keyword Coral Springs to the number 888-777. I'd like to thank Dr. Antevi for being with us here today, and Commissioner Vignola. Before we leave, Commissioner Vignola, would you have anything else you'd like to say to the residents?
hope everyone stays safe and healthy. And I want to thank you, Alex and Dr. Antebi, for everything you guys do, keeping our residents informed and continuing to provide these updates to our residents.
Thank you, Commissioner. Thank you to all of you who tuned into our Facebook Live. We will see you again this time next Monday. We wish you the best week. We wish you to stay safe, stay healthy, and stay home. Thank you.